Rob's rule number 1 covers the actual psycho-spiritual, meaningful aspects of ill health, which is never part of conventional model at all.
No.
And for me, that's number 1 and so important. Of course, then there is the whole question of choices of food. Because if you look at the whole food terrain at the moment, it's in a way a little bit chaotic. What really got me was how confusing it is for people, because they keep hearing from experts, that this is the most healthy diet of all, which is Banting diet or Mediterranean diet or the vegan diet. And what really happened to me was coming across a scientific article on the use of the macrobiotic diet for treating diabetes, a high carbohydrate diet, and yet they showed clearly that the macrobiotic diet did better than a lot of other diets.
Really?
Yeah. And that got me thinking, first of all, there's no one diet for one person. Everybody is unique and everybody needs different things. Secondly, the first diet that I used was my cleansing diet, which is nothing more than potatoes and onions and greens.
Yes.
And that's quite high carb as well, actually. Yeah. And that changed everything. And I realized then that it was because I'd stopped them from eating the junk food.
Yeah.
And they were just eating ordinary food from the earth. And that's what I think is what's so important, is that we eat quality food. It's not a question of Banting or macrobiotic.
Yeah.
It's a quality of food that makes you feel good. And you have to go on your intuition around it,
Okay, because that's quite a leap, isn't it, to encourage your patients to listen to their intuition? Because again, I don't think that's part of the conventional medical model, is it?
No.
Is to say, well, if this medicine doesn't feel right for you, then it isn't right for you. And you're saying around the most important medicine, which is your food, what you take in several times a day, is
it
that
should
you
be
have
fresh.
to listen to.
It should be organic.
Yeah.
And it should be out of the earth in some kind of way, free range. I personally follow more the Mediterranean style diet. Good vegetables, some fish every now and again, a little bit of meat, glass of wine if you want, red wine, of course, not white wine.
Why red wine, not white?
Because red wine has got the resveratrols in, which is the...
I've never heard that word, resveratrol.
Resveratrols, those are the antioxidants, the good antioxidants. So that's why red wine is more healthy. Wine has got alcohol, and alcohol is a liver poison.
Oh, right. Yes, of course.
So the resveratrol kind of counteracts the alcoholic aspect in some people, not in everyone. So I think for me it's a question of quality of food that you're eating and not so much what diet you have.
Yes.
That's the most important part when it comes to food choices. Exercise, I'm actually astonished at exercise, because I've always done exercise. My body's always needed exercise. But I started to have pains in my shoulder. And usually the idea, if you've got pains in your shoulder and your knees, rest it.
Yeah.
Well, the truth is, and you speak to anybody who does exercise, the more exercise you do, the better it is for your joints. So don't stop exercising your joints because it becomes painful.
Yes.
Actually, all aches and noises that were in my shoulder all disappeared when I started to do just this kind of exercise.
Yeah.
So I usually start in the morning doing I can do this 140 times.
Wow.
Not continuous. I do this and I do this and I do that 20 times, but in the end I do 140 times and I'm 81.
And you go on a walk every day.
And I do my walk as well. So I think that exercise is really important. It's like massaging your body, it's getting your circulation to go. So exercise really, really, really important. I saw a study a few days ago that showed that lifestyle changes can add 10 to 15 years of life to you. That's exercise, stress management, food choices, no smoking, cut down on alcohol, just that. Nothing can beat it. There is no natural medicine drug on the market that can give you 10 to 15 years extra life. Lifestyle can.
That's a very big number.
It is a very big number.
What's striking me listening to you is that the dominant approach to exercise strikes me as very intensive. Like you see people doing these huge cycle rides and pushing themselves running in the early mornings and going to gym and doing ferocious exercise several times a week before going to their offices and that sort of thing. And similarly with diets, there's a certain intensity around, as you said, I'm going to do this diet because this diet says I will be a better person or
Right.
wada. And what I'm hearing you say is more even paced and not asking for excess or pushing and proving
People
something.
become a bit fanatical about diets and about exercise, and you're quite right about exercise. I mean, I used to go to the gym in Stellenbosch, and I would tell everybody over there, please, when you finish your 1 hour of exercise, make sure you're taking lots of antioxidants, because all this exercise produces a lot of free radicals. Mm-hmm. And free radicals are dangerous. The body produces free radicals in order to kill viruses and bacteria. Mm-hmm. So I think of these free radicals like bands of savages running around in the body.
And they get woken up by exercise.
A lot of exercise that stresses the body.
Yeah.
A 12-hour marathon that people do seems a little bit crazy to me because you're producing a lot of free radicals. 2 people died in the last long marathon.
Yeah. The savages got them.
The savages got them.
What is an antioxidant that you would take after
So it's interesting because the free radicals are these bands of warriors running around looking for virus and bacteria, and they can't find them, then they destroy the body. So what counteracts free radicals? Free radicals are the masculine side. The feminine side is the antioxidants. And the antioxidants come, my darling, let's dance together. So that's the antioxidants, you see, and the antioxidants neutralize the free radicals.
That's a lovely story.
Yeah, it is.
What do they look like in real life?
Well, so resveratrol.
Can you take resveratrol?
Yeah.
So you go and have a glass of wine after your red wine after your...
No, I don't. I mean, you can buy it in a pill.
Oh,
so
that's interesting.
The green vegetables, all the green vegetables contain a whole range. There's a whole range of different antioxidants. Chocolate has a lot of
Really?
antioxidants.
So chocolate is quite feminine. Wow.
The first part of integrative medicine is looking at the lifestyle, because I know that if I can get the patient to change their lifestyle, I'm going to add 10 to 15 years of their life. I could turn around a chronic disease completely just by getting them to food choices, getting them to do some exercise, changing their story. Water do you drink? Mm-hmm. I mean, if you're drinking municipal water's got chlorine in.
Yeah.
Well, chlorine is
great.
What's the reason for chlorine?
To kill
Bacteria and viruses. And what is your gut full of?
Guess what?
Bacteria and viruses. So chlorine is already interfering with that whole probiotic systems in the bowels. Doesn't make any sense to me. So one really does need to check out the water that you drink. Everybody should be having filtered water. I'm not sure I like bottled water because most of it is in plastic anyway, but so everybody should be using some level of filtered water because that's important. What other pollution factors? I mean, one of the things I ask patients are, can you smell anything in work? Because if you can smell something, a chemical in your work, you're being poisoned. So it's important to ask them about chemicals, because if they live in an environment, working in an environment where they can smell chemicals all the time,
that's interesting, yes.
Those chemicals are getting inside the body, and then they really need to either change their job, speak to the boss about the fact that the space is being polluted, or they need to do something about helping their liver to deal with these toxins, because the liver filters out toxins. So, I mean, these are the directions that one is going in trying to look at the underlying causes.
All of this is a long conversation.
Yeah.
This doesn't come out in a
So
form.
a lot of doctors actually give forms to their patients to fill out.
Yeah.
All I will do in my first consultation is just ask them about underlying causes. And then at the end of the consultation, you say, now what am I going to give the patient? Well, I haven't even thought about that yet. So
you have your placebo ready at hand.
Well,
I always give my patients this little pill.
Well, no, so I do have a package.
Oh, really?
Everybody gets vitamin D.
Okay.
Why?
Yes. Why?
Because 85% of people that come into my room are deficient in vitamin D. I've checked it out.
Really?
Yeah. So,
Sure.
and even people that tell me, but I spend a lot of time in the sun. they still don't have optimum levels of vitamin D. If you follow the Vitamin D Council in America, they say your vitamin D levels need to be over 50. In South Africa, the laboratories say over 30. Well, it's over 30 is not enough. It really does need to be closer to 70 or 80 if you've got a chronic disease. Okay. So vitamin D is really important because it's your genetic expression can't really function well without vitamin D. Vitamin D is important for bone health, it's important for immune health, so it has a big part to play. So I just give everybody vitamin D because I know that they're all deficient. I don't even test it to be quite honest the first time. And then the other remedy I give them, which is also very important, is the omega-3s. Because I think we're running into serious trouble with the oils. I mean, even olive oil. I mean, everybody says olive oil is so healthy. I used to pour olive oil onto my salad. I've stopped doing that now because oils are incredibly sensitive. Oxygen gets in and causes the oil to go rancid and get oxidized. And the oxidized oils are free radicals. Yeah. When you buy an oil like olive oil, you should know exactly the date that it was pressed.
Really?
Yeah. If it's more than 6 months old, for me it's too old. I want to know that the oil is pressed recently. Often it's kept into clear glass. Yeah. The tops are off. It's in a heated environment. You're dealing with something which is really sensitive, and so even your cold-pressed olive oil becomes dangerous oil. I don't add any more olive oil to my food. I get it enough in food I buy, like for example, if you buy hummus or when oil has been extracted, you have to be really careful with it.
I can see a problem arising here in the mind of the layperson, your patients.
Yeah.
And I'm just following your eyes and looking around.
I'm looking around because suddenly I'm seeing which direction are we going.
Also, have we lost the path? Where is our path?
No, I know where the path is. We're still dealing with the underlying causes.
So I can see a possible problem in some people's minds. And I have to say, you're reminding me of I've had this problem from time to time of thinking, if I take you seriously, which I do, around what you've just said about various foods, oils, for example, and you make it sound as though there's a very narrow band of kind of reliably healthy oils or foods, not too processed, got to be organic and da-da-da. And I can end up feeling, gee, I'm never going to be that perfect. I mean, I've got to live and I'm a busy guy, and also I may not have the money to go and buy freshly pressed olive oil, etc., etc. You've worked out over the years and years you've been studying this stuff, what actually are the sort of benchmark levels of health-giving things to eat and drink and take into your body and do with your body. I'm just living a busy, hectic life. How do you help me to manage the gap I'm inevitably going to find between what you're sort of painting for me and when I go out of your room, I'm back in my life?
Yeah, no, so the thing is that I'm talking about what's ideal. Ideal is organic, fresh foods. Obviously, most people can't do that. I mean, in Cape Town and where I live, it's easy because we have organic stores everywhere. If you can't get organic, do the best you can.
Because that can, I realise, be a source of stress. Yeah, but I know, it's almost like if I didn't know I was supposed to be eating well, buying food is not a stressful activity. It's just, can I afford it? Do I like the look of it? Okay, well, will it taste good? But you're now adding this layer of potential stress by saying, actually, no, not that.
So I'm not fanatical. That's why I say my choice is a Mediterranean diet. And what is a Mediterranean diet? Is fresh vegetables, a bit of fish every now and again, a glass of wine. So a lot depends on what the person comes into the office with. If they come in with a serious condition, a really serious condition, I put them onto a vegetarian diet.
Okay.
I don't say it must be organic, but they must stay on vegetables only.
Okay.
And even no bread, no grains, just pure vegetables for a month or two.
Yeah.
Because for me, the vegetables are the cleansing kingdom. They allow the body a kind of freedom. Meat is more, somehow more aggressive stuff to deal with.
Demanding.
More demanding for the body.
Interesting.
So for me, my gut feeling is just plant-based diet.
Yeah, but I hear what you're saying, that particularly that if the need is great and the urgency is great, then you get more fanatical.
Then I'm more strict with people. Then I say, I want you to do 3 months vegetarian diet and let's see what the body does.
Yeah.
Because I know that in a way, Peter, it's that simple. Put the person onto a vegetarian diet. That's what I want you to do. Don't do anything else. Go on with the rest of your life, but just eat vegetables.
Right.
That's not difficult. If you've got a serious condition, a really serious condition.
And if you're not willing to do that, then...
Because what are you doing? When you're having a vegetarian diet, you're giving the body all the phytonutrients, all the antioxidants, all the nutrients that the liver needs to detoxify, and you're not putting any kind of stress on the body.
Yeah.
In that month or two, you're getting a chance to see what the body can do, because that's what you want.
Yeah.
Remember that what we're trying to do is to move dysfunction back to function.
Yes.
That's the second part of the process that we need to talk about now.